Good afternoon. Welcome. I'm excited to have you all here. Today, Feliz and I are going to talk about how our partners can help accelerate and can accelerate themselves with innovations of cloud and AI in healthcare and life sciences verticals. We'll go through some of our recent innovations, as well as some examples on how partners are able to use these innovations to accelerate the outcomes for their customers. First, let's talk about some industry challenges. Of course, the healthcare industry in general has had an amazing set of innovation and changes they had to react to. Starting with kind of the expectations for the patients. We're all patients. Patients are increasingly expecting a different way of engaging with either their payer or provider system. More than 70% of the patients and members expect a different type of more digital-first engagement. Then workforce burnout, very much true in this industry, in these verticals. We found that on the provider side, that physicians, about 50% of the physicians are affected by burnout. And by 2030, we expect to have about 10 million frontline work physicians short in the healthcare providers industry, 10 million, because physicians and nursing staff. These issues are real. Then we have the opportunity or the issue of data. 97% of the healthcare data currently gets unused. 97%. An average provider system generates about 50 petabytes of data annually across 10 different systems. And if we believe in the power of AI, we need to solve the data issue first. And lastly, security. This industry over the past few years has been at the top 10 of risk on being hacked. An average breach in healthcare is estimated about $11 million. So the exposure is real. Then there's the opportunity side. This is a McKinsey study that estimates the opportunity for generative AI in healthcare and life sciences to be about a $1 trillion opportunity of unrealized improvements in healthcare. But of course, in healthcare, it's not just about the dollar numbers or the euros or whatever currency you live in. What we see and find is that the opportunity to improve and help save lives is real with generative AI. And in Microsoft, when we look at healthcare life sciences, we distinguish the different verticals from provider, payer, pharma, and life sciences. And we're dedicated to create efficiency across this connected ecosystem. We need to make sure these ecosystems are connected, and they're even connected even more than we think. However, they're also bleeding over. More and more payer systems are starting to provide provider services. For example, clinical trials is something that connects the pharmaceuticals to providers. And medtech companies increasingly provide educated staff in the operating rooms. So these verticals are increasingly intertwined. And we're making this real through our increasingly deep investments in healthcare. In Microsoft, healthcare is by far the industry with the biggest dedicated investments from an IP and innovation perspective. We have dedicated engineering teams, as well as teams in Microsoft Research, that are looking at the bleeding edge from what AI can do in healthcare. Our focus on responsible AI is even deeper in a regulated industry like healthcare. The practices we apply to make sure we provide our services are safe to use and can be used in patient-facing settings. And of course, our commitment to trust, security, privacy, and compliancy. And lastly, and most importantly for this room, our commitment to the partner ecosystem. and work with partners with dedicated IP and practices around healthcare as part of our strategy. The way we externalize our commitment to healthcare is through the Microsoft Cloud for Healthcare. And in the Microsoft Cloud for Healthcare, we'll look at all the layers of the stack. Starting, of course, with security, through infrastructure, data, all the way to our SaaS applications. And in this stack, in this Microsoft Cloud Stack for Healthcare, you see a new application category called clinical applications. About 3 years ago, Microsoft acquired a company called Nuance Communications who has deep excellence in applications targeted at providers, with physicians, nurses, and radiologists. We have the commitment to bring that application portfolio into the Microsoft Cloud on the Microsoft entitlements for our customers and into the Microsoft partner programs. We are reaching more than 650,000 physicians on a daily basis for a product like Dragon. An amazing opportunity for us as a collective ecosystem to address that opportunity. So today, Feliz and I will show how partners play a critical role in this Microsoft Cloud for Healthcare. So with that, because our deep focus is on AI, I want to start with the Copilot stack. And the AI and Copilot stack is a complete set of technologies that extends and builds and allows you to innovate with AI. And our goal, of course, is to give the opportunity and the tools to partners that they need to innovate at each level of this and each layer of this stack. So we will share how, from a technology perspective, and we help in partners and also provide some examples of partner and customer case studies and how they've approached this to help our customers, our collective customers, move forward. And of course, whatever business priorities and strategies our customers have, it starts with trust. Trust in healthcare is table stakes. So to really empower organizations to accelerate and harness the full potential of AI, we need to transform in a secure and responsible manner. We're having to do with patient and safety data that is very important for us. In addition to starting with trust, of course, it starts also with cloud computing. And in Microsoft, we can benefit from the most comprehensive global infrastructure with 60 data center regions, more than any other cloud service provider. So just on the security and the infrastructure layer, there's a massive unrealized value that we can bring together for this industry. So let's start with security. So for our customers in healthcare and life sciences, cybersecurity is a top risk with millions of dollars that are being lost every day. We recently released a ransomware report, where again, healthcare is the top most targeted industries for the multiple quarters in a row. It's also costly. In a provider system, downtime will cost a provider on average about $900,000 a day. And what we found is that the organization that admitted that they paid ransomware, of course it's sometimes hard to admit, pay an average of $4.4 million. So just on the provider side, and this was just in the US, and we believe that in Europe, the problem might be even worse, because the cloud journey is a bit more behind there. So there's an amazing opportunity here for our partners to look at how we approach security in Microsoft. And the Microsoft security helps you protect your environment from every angle. And it includes compliancy, identity, device management, and privacy. And if you think about just the number of devices and the bedside devices that exist in healthcare, the opportunity is enormous. And we provide solutions across 50 different categories in one end-to-end Microsoft Security Cloud across these 6 priorities. And again, as you see in the slides, we can work across multiple clouds and multiple platforms. from threat protection to cloud security, from the basis of data security to compliancy and privacy and identity management and access. So we have the opportunity, but almost like the obligation, to provide and work with our customers to secure their environments in healthcare. And if you read the news cycles of when a healthcare system goes down, how they need to turn around and turn away patients, this is kind of the basis for a good healthcare system. The second opportunity here is what we call the life-critical infrastructure. And with our focus on making Azure the preferred life-critical infrastructure, we get best of both worlds. We have an optimized platform that fully embraces AI, while our customers can maximize the ROI and with the necessary performance and resilience. Azure is the best cloud to deliver industry-leading best-in-class solutions across either the Microsoft workloads or third-party workloads like SAP, NetApps, VMware, and also Epic, very important in the US healthcare system. And earlier this week, we announced some dedicated improvements on our infrastructure for Epic and Epic on Azure, where we now have a performance of 65 million grefs, global references per second, for an Epic installation. That's a year-over-year improvement of 171%. And if you think about the opportunity to host your core Epic instance on Microsoft's life-critical Azure infrastructure, there's a lot of opportunity here for our partners. So let me now welcome on stage Feliz Montpellier, a general manager for the healthcare partners at Microsoft, who would love to share some opportunities that, and some examples that I see with our customers and partners. Feliz.
Thanks, Kees. It's great to be joining you on stage, and it's really great to be here with our healthcare partners and our aspiring healthcare partners, both in the room and online. So would love to take some of the topics that you have and actually make it real and talk about some of the case studies that we have. So a great example that really showcases the end-to-end security portfolio is the work from partner BlueVoyant and their customer Steward Healthcare. So with more than 43,000 employees, with hundreds of hospitals across the United States, Steward Health is laser focused on cybersecurity. And when they saw increased attacks and the stresses of healthcare operations that coincided with the COVID-19 pandemic, the company was really searching for a new security vision. And so Steward Healthcare augmented their security staff with cybersecurity managed service provider BlueVoyant, and rolled out the Microsoft Security Solutions Suite, notably Microsoft Sentinel, Microsoft Defender product family, and Microsoft Defender for Endpoint. And so the company now avoids that alert fatigue from the constant alerts. And partnering with BlueVoyant to provide the managed detection and response services keeps the Steward Health team expertise where they really needed it most, and then while they're optimizing the value of the Microsoft security solutions. Another great example is an infrastructure example and the work with Mount Sinai Health Systems. So you may know, as one of the New York's largest academic medical systems, Mount Sinai began experiencing significant outages, and they were really challenged with their on-prem Epic environment. And these were really the result of a lot of underlying data center infrastructure elements. And it was complex, it was really time consuming. And so what was happening was they were managing all these elements and it was pulling their hospital resources away from the innovation as staff devoted more and more time to system maintenance, to fixes, really decreasing their ability to adopt new technologies and focus on that pace of innovation and research. So after partnering with Accenture, they chose the Microsoft Azure Cloud, and that really enabled them to drive data collection across their workloads. They adopted a reference architecture that was purpose-built for Epic, And then they also built compute capacity to accelerate their AI innovation and better meet their future needs of their patients. And so in the end, Mount Sinai scaled 3 terabytes of annual data growth using AI on Azure. And the great news is they're already seeing the benefits. They are more nimble. They can contract and expand based on the demand of the healthcare services that are required. They've eliminated their outages since they're no longer having to manage all those various infrastructure elements in their own data center. And then they've built a focus really on driving sustainability initiatives. So they're using Microsoft Sustainability Dashboard so they can actually see the carbon emissions decrease as they move and offboard their own data center. So it's really been a great success in the early days of Mount Sinai and this rollout. And in the end, they can really focus more and ensure better patient experiences and securing their status as a leader in innovative care. Kees, do you want to talk about some of the opportunities we have with data?
Yeah, thank you. So I'll take the clicker back. Thank you, Feliz. Yeah, of course, other than we talked about the infrastructure, the need for security, great example with Mount Sinai. But then the fuel of AI is data. And the data is at the center of AI. And our focus there is really, we talked a bit about that massive volume of data that gets untapped and is still siloed. So for us, our focus is really help break down the data silos to help companies make smarter decisions. So for us, the focus is a unified data platform that connects disparate systems to focus on meaningful, consumable, and actionable outcomes. And in order to bring that to life, our focus here is around Microsoft Fabric. So Microsoft Fabric, as you hopefully heard, is Microsoft's data platform for the era of AI. We've 2 weeks ago announced the general availability of the healthcare data solutions in Microsoft Fabric to really help our enterprise analytics solutions to build on the top of the Fabric platform. For our partners, that solution enables you to help healthcare organizations to connect disparate healthcare data systems across different types. We talked about electronic healthcare records, like we just saw with Mount Sinai, imaging data, laboratory data, et cetera. And regardless where it sits, it doesn't matter if it sits on Azure, sits on premise, maybe still on AWS. With Fabric, we can reach across. It also harmonizes the data and harmonizes a diverse set of records and data models that transform these pipelines to create a multi-model data warehouse that adheres to industry standards like FHIR and DICOM. And it also helps that time to insight and to ease the administrative burden with out-of-the-box healthcare solutions, or customers or partners can develop their own. And Fabric in itself, with these solutions, is HIPAA compliant. So maybe, Feliz, you have some great examples for how a partner can utilize.
Sure. Happy to do that. So Fractal's work at Shriners Children is actually a great example of the power of Fabric. Shriners Children is a network of hospitals that offers pediatric care. And their clinical diagnosis and treatment of patients is based on information gathered in clinical notes. But these notes were hosted in outdated systems. A lot of them were handwritten and hard to comprehend. And so further, the organization really relied on their analytics team to provide insights from all these clinical notes, whether they were handwritten or half in the systems, and it was really time-consuming and inefficient. And so Shriners, they tapped Fractal, which is a pure-play analytics company, to help them build a next-generation research system and processes to improve this process. So they developed an AI platform for Shriners so their clinicians could easily and securely navigate patient data in a singular location. Fractal used Microsoft Azure to build the Shriners long-term solution based on Azure OpenAI, Microsoft Fabric, and other Azure services. So in under 4 weeks, Fractal developed a solution that they called Shriners GPT. which enables the creation of a chat board, which the Shriners Research doctors use, and it eliminated that manual clinical notes process. So now the clinicians, the researchers, can leverage Gen AI to easily and quickly search the database and the vast library of notes to accelerate their research really interactively and powerfully. So Microsoft Fabric played a critical role. It helped foster the collaboration by allowing users to share the insights, the reports, the dashboards, seamlessly across teams. And as the business grows, Fabric can be scaled up or down to handle the increased data volumes without compromising the performance. So, Kees, I'll turn it back to you to talk more about AI in healthcare.
Thank you, please. So the pace of AI innovation, of course, in healthcare has been incredible. And the reasons why we're able to move so fast is because we've built our Microsoft Copilots and everything we do on a top layer on top of one platform, Microsoft Azure. And of course, Azure includes several categories of AI capability, including including advanced services and purposeful built AI search, machine learning, and of course, Azure AI Foundry. So having an AI toolchain and app service that developers can use to create those amazing Copilot experiences, and the foundation building blocks include infrastructure and foundation models trained on that infrastructure. So in healthcare, we think with these foundation models, there's an untapped opportunity for us in AI using these technologies, as well as, of course, the healthcare data we just talked about. So in healthcare, 99% of the data is actually unstructured and multimodal. Most of the multimodal data is not public and is siloed across many players, from imaging, diagnosis, operational, and research. So creating a true complete picture of a patient healthcare or patient health might be difficult. And we believe in Microsoft, this is a huge untapped opportunity to learn more and do more with that life-critical information. So what we've done here at HLTH is actually announced, or 2 weeks ago, we announced a set of multimodal healthcare AI foundation models in Azure AI Foundry. So to bring that again back into those familiar Azure AI Foundry experiences to bridge this gap. And these healthcare models go beyond text, in particular around medical imaging. So we've trained these specifically on imaging and data not available in the public domain. These are state-of-the-art models across many academic and industry benchmarks, and this offer kind of a best-in-class performance for medical imaging and beyond. And at first release, we focus on releasing them in open source with both the licensing for research as well as in production. They also come with detailed model cards, very important for transparency, and pre-built notebooks to accelerate developer onboarding and enable faster customization for specific use cases. Remember, these models themselves are a starting point for a developer. And finally, these healthcare models are integrated in Microsoft Fabric and Azure AI Foundry, allowing users to evaluate, fine-tune, and customize models to meet their healthcare-specific and data type needs. And again, we expect developers, customers, and partners to take these models and take the last mile for the customers. So Feliz, I'll pass it to you to share about how partners can use this.
Thanks. Thanks, Kees. Hopefully everyone heard earlier in the week, Satya mentioned in his keynote on Tuesday, the industry AI models are creating an amazing opportunity for partners. So it's a really exciting topic for us to bring today and talk about. So these models will drive the advancement in pharma, in biotech, in clinical applications, really enhancing discovery, development, and delivery of healthcare solutions. This progress brings to the field, closer realization of the full potential of AI in healthcare and delivering next-gen benefits and capabilities for the future. So organizations like Page, which Satya talked a little bit about earlier in the week, which is developing models for oncology, Sectra with models for radiology, and also other partners and customers like NVIDIA, like Providence, many more in the ecosystem, including the veterinary domain with Mars Pet Care. They're already using these models to accelerate AI development across the healthcare landscape and across modalities. So the doors are open really for partners to delve into the pro code developer opportunity. And that's really just a start. So now there's also the opportunity to extend Microsoft Copilot and build new healthcare copilots. So Kees, let's jump in to the next set of opportunities for impact.
Thank you. As Feliz talked about, and of course you didn't hear enough from Microsoft, we think that generative AI has an enormous opportunity and can be a catalyst for a transformation that healthcare so desperately needs. But while healthcare organizations are eager to implement AI, they're also looking at ways to minimize complexity and maximize the responsibility and safety. So this is where we think our latest investments in copilots and healthcare agents is important, and with them, the opportunity here we think is vast. So I think I want to provide a demo. Oh yeah, so at HLTH, we announced the healthcare agents in Microsoft Copilot Studio. Really benefiting from all the investments as a company we're making in Copilot Studio as a low-code toolkit, and enabling skills, healthcare-specific skills, to be utilized that can really focus on quality checks and making sure you provide credible sources. We think there's a tremendous unlock for partners here. Creating AI agents to address healthcare's most pressing needs, while staying aligned to Microsoft's trustworthy AI commitments and deliver robust security and privacy and safety to our customers. We want to take a look at a demo to bring this concept home and how a partner can use this in context of some customer scenarios.
Accurate contextual responses to healthcare questions are crucial to ensuring patient care and safety. With Microsoft Cloud for Healthcare, we'll showcase how healthcare agents can be transformative for both healthcare staff and patients. New extension capabilities within the Healthcare Agent Service monitor and verify that health-relevant safeguards are in place, helping protect patient data and adherence to privacy regulations. Taylor, a director of informatics, oversees his organization's IT systems and is improving how patients and staff engage with the Copilot experience. He works within Microsoft Copilot Studio, a low-code tool for creating and maintaining AI-powered conversational interfaces based on large language models. He creates healthcare agents using the Healthcare Agent Service that align answers with predefined safeguards to support the diverse use cases of patients and clinicians, along with the ability to publish into applications used across the organization. These safeguards support the patient experience by reinforcing chat, clinical, and compliance safeguards through AI-related disclaimers and align with adapted abuse monitoring. Quality checks allow verification of clinical evidence associated with answers, flagging fabrications and omissions, as well as verifying credible sources. The Healthcare Agent Service is built with extensibility in mind, enabling Taylor to connect internal data as well as external sources, such as the U.S. National Library of Medicine, the CDC, and open API plugins that leverage AI models against healthcare data. This integration of generative AI with healthcare-specific safeguards allows for a more accurate and reliable service, meeting the unique needs of the healthcare industry. Reed, a patient of Contoso Healthcare, uses his patient access to start a chat to help improve his understanding of interstitial lung disease. The healthcare agent for patients returns a structured response, which initially has some unfamiliar terms, so he asks again for the language to be simplified. Within this response, Reed sees the validity of the source and a disclaimer that this response has been AI-generated, and he should still seek guidance from a medical professional. Dr. Irene leverages a healthcare agent in Microsoft Teams to query ongoing clinical trials, taking advantage of the open API extensibility that enabled a model from Azure AI Health Insights to search for interstitial lung disease. With a single route to query via verified sources, Dr. Irene is able to review, validate, and share insights with her team and expedite a response to a patient like Reed. Throughout, the AI models adhere to the principles of responsible AI. You've just seen better experiences, better insights, better care.
So what you just saw is a service we just released in public preview 2 weeks ago at HLTH. And with that, you can leverage Copilot Studio to build these custom Copilot agents across the different verticals. And we believe it's not just about provider, but we see opportunities in pharma and others as well. In addition to that service, we're also releasing in private preview, and we're looking for some partners here, some of these safeguards. We will also make them available as pro-code APIs. So if you have existing projects where you think you can use some of the safeguards, this is an excellent way to kind of fast track your project. And there's about 5 of the 8 that we also released through this API. So here's a link to the sign up. So if you have interest and you want to look at a private preview of the pro-code API services, here's an opportunity for our partners. So as we just walked through the stack as a Microsoft Cloud for Healthcare, we think there's an opportunity across every layer of the stack, across all verticals. So personally, I can't wait to see what this community can do to accelerate the rate of innovation across the healthcare and life sciences verticals to provide better health and better care. So I went and hand it over back to Feliz to go through some of the partner programs that we have to help you be successful. Feliz.
Thanks, Kees. So the reason why we brought our Ignite and our Inspire conferences together is to bring our customer and partners together. And it's about creating partner opportunities for everyone in the room. So I'm super excited, to close this out and talk about some of the great partner opportunities. With AI in the hands of everyone, there's really an exciting opportunity to drive real impact now across the healthcare value chain. And they're just some of the scenarios and use cases here, from more personalized healthcare to clinical documentation, from helping improve member insights to more efficient drug development and discovery. AI is here to help. And these are just a few examples that analysts see as areas where AI can drive impact. And that means areas where all of you can drive impact together for our customers. The possibilities of AI are really endless, and creating opportunities for you to drive impact for healthcare customers and for the well-being of our society. So it's just such an exciting time in healthcare overall. So we're really here to invest in your success. From skilling, we empower your teams with dedicated partner skilling and AI workshops. Differentiation, you can earn specializations and industry AI designations to differentiate your business, your services, your IP. Go-to-market, scale go-to-market with assets aligned to cases by industry, and then different offerings. So we can accelerate cloud AI adoption with expert help and resources. There are direct links here. You can go to any of those links to find out more details on each one of these areas. In addition, make your way down to the Industry Experience Zone. We have experts there on the floor to help showcase some of these solutions that we talked about today. They'll help you understand some of the partner programs. You can feel free also to self-learn at partner.microsoft.com, so you can navigate some of that on your own. But please join us in the Industry Experience Zone as well down at the hub. So with that, we do have a few minutes for questions. So if Kees wants to come back up, if anyone has any questions, we have at least one mic in the room. Feel free to step up to the mic. We do have people online. It's a free opportunity to test our knowledge.
Or shout out and we'll repeat
Or shout out and we can repeat it. Go for, yeah, in the back.
Thanks. So in regards to the differentiation, can you kind of double-click into the idea of how to get the AI designations? Are they specifically for IP-based solutions, so software that's basically sitting on Azure, or are they service offerings? It doesn't seem to be a lot of clarity on that.
Sure, I can take that one.
Yeah, repeat.
Yeah, I'll take that one. Oh, so I'll repeat the question for those online. There was a question about specificity, specifically around differentiation, about earning the industry AI designation that we have. So we, in the spring, actually right around the HIMSS timeline, we launched our, it was software-specific, software designations. We have broader solution area designations as well, but for software IP partners, we have an ability now to differentiate through a designation that is specific to AI and industry, so specific to healthcare AI. So if you do, you go through a validation process that looks at your readiness for the commercial marketplace, which is how we would transact it. It looks at your track record of success and other elements that will validate that it works with the Microsoft Cloud. So once you go through that validation, you can earn that specialization and that industry designation for industry AI. So what we launched in the spring, specific here, was specific to our industry, our software IP partners, but we also have broader designations as well around our solution area. So hopefully that helps. And I'm happy to talk offline as well when we're done here. Any other questions?
Any other? But we've been so clear.
Yeah, it's great. Well, thank you for joining us. Thank you for joining Kees and I. It's great to have everyone here. I hope you enjoy the rest of your Ignite and that you make it to the party tonight. Thank you.
Thank you.